Okay, everybody, welcome back to the channel. This is the Mental Health Matters Take 5 series, where we are going to talk a little bit about some of the latest research, perhaps some older research, but in general I'm going to talk about some trends in the field as well as some mental health tips perhaps, and it should take hopefully about 5 minutes if I can manage to be succinct. So today we're going to talk a little bit about 2 research articles related to exercise and why exercise is beneficial for your mental health, and perhaps what kind of exercise and in what ways is it beneficial. So I'm glad that you're joining us, so sit back and we'll check these 2 articles out. This first article is an article that was a review of a lot of research that was done, and this was done out of the Center for Neuroscience at NYU and was posted in Brain Plasticity. And so they were checking on the effects of acute exercise on mood, cognition, neurophysiology, and neurochemical pathways. And they wanted to review some of the research that's been done on that and give some ideas as to how acute exercise, meaning right after you exercise and for a period of time not long after that, how does that impact you psychologically and physically? And what they found was pretty interesting. Really a couple of main points here. One of them is that they found that acute exercise improved cognitive tasks that involve the prefrontal cortex. Now, the prefrontal cortex is involved in behavior, speech, reasoning, short-term memory, and possibly preparatory action as well. They also found that it improved mood and decreases in subjective levels of distress in people who had recently exercised. A little weaker association, but they did find some evidence to suggest some long-term improvements in things like memory and emotional functioning as well. So even though they were looking at the acute effects of exercise, they also tried to look a little bit at long-term effects as well. And they looked at individuals that they concluded were highly fit based on a number of parameters, and they showed that those high-fit individuals compared to their low-fit counterparts show a decreased physiological and psychological response to stressors other than exercise, effectively showing that exercise seems to allow one to handle other stressors a little more efficiently, such as family stress, work stress, and things like that. In rodents, they found a potent antidepressant and anti-anxiety-like effect at similar or greater levels than that of pharmacological interventions. That essentially means that based on the rodent models that they looked at, they found that exercise was as effective or more effective than medication at controlling depressive and anxiety-related symptoms. Now, that doesn't mean go out and throw all of your medications away. Correlation does not necessarily equal causation, and it's important to just note that this is, one study, one piece of a study looking at information. The second study that I want to draw your attention to is one that was just recently released on April 16th that's entitled Physical Exercise, Mental Health Problems, and Suicide Attempts in University Students. This was done in Norway and was published in the BMC Psychiatry Journal. They actually looked at over 50,000 college students aged 18 to 35, had them complete a Hopkins Symptoms Checklist, which is a 25-question screen that measures things like depressive symptoms, anxiety symptoms, and other symptoms related to mental health. They also did a depression self-report and assessed the number of suicide attempts and did an adult psych morbidity survey as well. They looked at 3 pieces of exercise: frequency, duration, and intensity, and found that specifically frequency of exercise seemed to be the highest correlated factor determining the benefit of exercise on mental health, at least in their study. What they found was that there were lower numbers of suicide attempts, lower numbers of reports of depression, lower numbers of anxiety, and indeed lower numbers of all reported mental health symptoms with those who had exercised most frequently. And if we look at this chart, it actually shows that data. It shows that the more someone exercised, the less likely they were to experience significant mental health problems, including suicide attempts. So this goes to show that there's still a lot to learn, but it seems as though it's not necessarily related to how intensely we work out. It's not necessarily related to what we even do. It's a matter of doing whatever it is that we can do and doing it as frequently as we can within reason. And so it seems that if we can maintain some level of consistency with our exercise, that perhaps we might be able to prevent some of these mental health concerns and mental health problems. It's important to note here that these are just a couple of articles, and while the information seems to be good, the studies seem to be well designed, it's important to recognize that we may find information in the future that contradicts this information, and we may find updated information that is more complete than what we found here today. The bottom line, though, is that it seems pretty clear, based on this research and past research, that living something of an active lifestyle within your capabilities and based on any limitations that you may have is clearly beneficial for overall mental and physical health. I hope that you found this information helpful. If this is your first time here, please hit the like and the subscribe button, and I hope that you'll be back for future episodes. Take care.